Oh, hello there! Hello to all the nurse chumps out there. I'm Nurse Niezl and welcome back to my channel. To those of you who are new here, thank you and welcome to the team! Like I always said, another day to learn about OSCE and another day closer to becoming a UK registered nurse. If you are about to take your OSCE anytime soon, then this video is for you. So before we go through this, I'd like to give this video a like and subscribe to my channel and become part of the team. Also, if you wanted to get notified every time I post new videos regarding OSCE, please hit the notification bell, somewhere over there. I would really appreciate it and I'd be more enthusiastic to post more videos. Today we're going to discuss Oral Care Plan Station. That being said, let's begin. Yes, the thumbnail of this video is about Oral Care Plan. This Oral Care Plan has just been added by the NMC as part of the new Nmc Osce Skill Station last November 2022. And remember, there are 4 scenarios under Oral Care Planning. Okay, and today we're going to discuss one of them. There are 4 scenarios. We have got critical care scenarios, learning and physical disability, cancer treatment, and end of life. So today, yes, you are right, we're gonna deal with the cancer treatment. Okay guys, to achieve the full mark, you need to write at least a minimum of 6 relevant aspects of care. Okay, how are we gonna write this one? Okay, we're gonna go through the marking criteria for this Oral Care Plan, but remember, there are 4 scenarios, so each scenarios got different intervention. These interventions are specific to that scenario. Like I said, today we're gonna deal with cancer treatment, and we're gonna make this marking criteria right here because there are too many and my eyes get tired just by looking at it. We're gonna make it simpler. Okay, we're gonna make it simpler for us to be able to remember all of them. Okay, we're gonna make a keywords out of this one so it's easy for us to remember. But I do want you to know that the marking criteria is the Bible of the OSCE exam. If you don't know the marking criteria, then you won't know the answer that you're gonna write or what are those steps that you're gonna do. I'm not saying that you just need to copy or memorize them and then paste it on your or write them in your exam paper. No, you have to know this by heart, because once you become a registered nurse, you got your PIN, you practice in the hospital, community, or even care home, you have this additional skill of knowing how to do an oral care plan and what to do just in case you have this patient on these 4 different scenarios. Okay? Alright, so I need you to understand rather than memorizing all of them. Okay? Let's begin. Okay, so the first marking criteria is twice daily teeth cleaning with soft toothbrush if the patient is able to tolerate. So what's our keyword that we can remember for this one? Again, toothbrush. I'll choose toothbrush. When I see this word, I'm gonna be okay, toothbrush. I need to brush the patient's teeth twice daily using a soft toothbrush if the patient is able to tolerate them. Okay, the next one, twice daily chlorhexidine mouthwash if the patient is able to tolerate it. Again, keyword mouthwash. I'm gonna put it there, mouthwash. I know what to write if I see this word. Okay, see how easy it is if you get the keywords out of this to this so far. Okay, the next marking criteria would be regular oral cleansing or hydration. How are we gonna show this? Again, by sips of water and then ice chips. Okay, you can do this one by giving the patients ice chips. Regular cleansing can be done throughout the day. Alright, so again, what's the keyword that we can remember here? I'll just say sips of water or ice chips. I think that's the best one there. Okay, next criteria is apply oral moisturizer to the oral mucosa and the lip balm to the lips every 2 to 4 hours. So what's the keyword that we can take from this one? Yeah, oral moisturizer. Well done. Next criteria is use artificial saliva. Why do we use artificial saliva, by the way? Yes, this artificial saliva is used to temporarily moisten and lubricates the mouth, where it actually creates a protective barrier or film. This barrier or film will help prevent or will help reduce the risk of chronic dry mouth and at some point infection. Okay, that's why we use artificial saliva. Next one is offers analgesia. Okay, if the patient have a cancer, especially in the mouth, then before even cleaning it, make sure you offer an analgesia to the patient. Doesn't matter if it's paracetamol, codeine, any kinds of analgesia, as long as it's prescribed by the doctor and the patient is not allergic, as long as it's prescribed to the patient. Okay, all right, so you can offer analgesia as prescribed, okay, by the doctor, as prescribed. Okay, identifies the need to reassess the mouth again 8 hourly. Okay, 8 hourly, just like in other scenario, it's always 8 hourly. Okay, the key word for that one is reassess. Yeah, reassessment or monitor. And also, just like the other scenario, you have to identify any other aspects of care that you can add to this which is not on the list. Okay, anything that would add on that one. What's the key word for that one? Relevant and evidence-based. Yeah, that's correct. Okay, again, every scenario got those two, bottom two. Okay, the 8 hourly reassessment and then any identified aspects of care. So good for you guys, since you don't need to memorize all those things. You know that there's two definite answer that is the same on all 4 of the scenarios, which is good. Again, remember, you need at least a minimum of 6 relevant aspects of care. Okay, at least 6 for you to pass. Okay, now to the most awaited segment. We're gonna do a sample scenario and I'm gonna give you my answer to it. Okay, I'm gonna give this scenario to you right here. Okay, I'm gonna read the scenario now. We've got this patient. You are a nurse in the oncology unit taking care of Michael Watts, and at the moment the patient is receiving a chemotherapy. So the patient is now on the 3rd chemotherapy session and is already complaining of dry mouth. The patient is also complaining of painful mouth ulcers. I need you to write a care plan on how to provide an adequate oral care to the patient based on the scenario that I have just mentioned. Okay, you can pause this video and write it, and make sure you time yourself for 8 minutes. Okay, that this is the only way you can practice. Okay, practice is the key, I always tell my nurses. Okay, ready? Okay, you can pause this video right over here. Oh, that was quick. All right, so do you have your answers with you? Have you done it within 8 minutes? Okay, so now here's my answer. This again, let me just remind you, this is just my answer. This is just my take on this exam. Okay, just in case I go for an oral care plan test, then these are all the answers that I'm gonna put. Okay, here it is. Enjoy. I will do an oral care to the patient by cleaning teeth with soft toothbrush twice daily if the patient is able to tolerate the procedure. If patient is able to tolerate, I will give the patient chlorhexidine mouthwash. I will regularly perform mouth cleansing or hydration by giving Michael ice chips or encourage him to take sips of water throughout the day. I will educate the patient regarding the importance of keeping the lips clean and moist using moisturizer or a lip balm. I will offer the patient prescribed analgesia before performing an oral care. I will then reassess and monitor the patient every 8 hourly. And just like that, we are now finished on the cancer treatment scenario for our oral care plan making. So, if you have a question or any other suggestion regarding OSCE videos, please comment down below. Also, give this video a like and don't forget to subscribe to my channel and join the team. Also, if you wanted to get notified, just in case I post more videos, please do hit the notification bell right there. Again, can I just remind you, there are other oral care plan scenarios, okay? Just explore my channel. There are other videos right there. I'm gonna put the next one right here, okay? Thank you so much for joining me today. I hope you learned something for today and good luck on your exam. This has been Nurse Niezl. See you on the next one. Bye!